Hello everyone, my name is Brittany Hale and I am currently enrolled with Herzing University. During this presentation, I will go over the differences between code sets, parts of Medicare, the different claim forms used, and explain institutional and professional billing. With billing and coding, you should know the differences between CPT, ICD-10, and HCPCS. CPT coding is used for services and procedures performed by doctors. HCPCS coding sets is used for the supplies used in equipment. ICD-10 explains the diagnosis, while billing, all codes are entered on the claim forms to provide the payer a story. If the code sets do not align with one another, the claim may be rejected. It is our responsibility to ensure the codes line up and explain the full story of the patient's encounter with the provider. Current procedure terminology, or CPT, code sets are categorized into 3 categories. All CPT codes are 5 characters long, some containing only digits, while some are alphanumeric. Category 1 corresponds to the specific procedure or service performed and is only numeric code sets. Category 2 is used for tracking the performance measurement and is alphanumeric. Category 3 is also alphanumeric and is used for the new or developing procedures that are not yet in Category 1. All Category 3 codes end with a terminal letter. Healthcare Common Procedure Coding System, or HCPCS, is a coding system used for supplies and equipment. HCPCS codes are 5 characters long and organized into 2 levels. Level 1 consists of numeric set that is identical to CPT code sets. Level 2 is alphanumeric and codes for supplies that are not found in Level 1. Some of the Level 2 codes are for wheelchairs, walkers, ambulance, prosthetics, and other non-physician services. Internal Classification of Diseases, or ICD-10 code sets, can range from 3 to 7 characters long and is alphanumeric. With an ICD-10 code, the first character is always an alpha but never a U. ICD codes contain a decimal point, which is placed after the 3rd character of the code. ICD-10 codes are the component in which explains the diagnosis and is used to explain why the procedure charge is being billed, along with any equipment and supplies. When coding for the ICD code set, it is vital to look for all factors within the diagnosis. Some diagnoses can be caused by another factor, and within the coding there may be a specific code for the underlying causing factor. While applying the code sets, always be sure it explains the full story. Moving on to the next topic, Medicare. Medicare consists of 4 elements, and to be eligible, one must be either the age 65 or older, some younger individuals, but they must have an approved disability, and some people with end-stage renal disease. The 4 elements of Medicare are Part A, B, C, and D. Part A is for hospital insurance. Part B is medical insurance. Part C is the Medicare Advantage plan. And Part D is drug coverage. I will explain each element in the following slides. Medicare Part A is one of the elements that is considered part of the original Medicare. Part A covers hospital stays, skilled nursing facilities or nursing homes, hospice care, and some home health care. The initial enrollment period, or IEP, is 7 months long and starts 3 months before the beneficiary's birthday, the birth month, and the 3 months after the birth month. There are other opportunities to enroll if the initial enrollment is missed. Medicare Part B is the next element of the original Medicare. Medicare Part B covers services like Medicare insurance. Some services that are covered under Part B are services from doctors, outpatient care, some medical expenses, and most preventive care services. Part B is an optional coverage but pairs with Part A. Unlike Part A, Part B requires a fee and often beneficiaries may delay enrollment, but the enrollment period is the same as Part A. If enrollment is delayed, the beneficiary may be penalized for the time delayed. Some individuals opt out of Part B and obtain Part C, which is an element that combines all parts, including drug coverage. Part C, or the Medicare Advantage Plan, combines all coverage types: hospital insurance, medical insurance, drug coverage, and often offers other coverages like dental, vision, and hearing. With the Medicare Advantage Plan, the coverage is provided from a contracted company, and the beneficiary can choose from a health maintenance organization, or HMO, preferred provider organization, or PPO, private fee-for-service, special needs plan, or Medicare Medical Savings Account plan. One of the differences between having a Part A and B, or Part C, is the Medicare Advantage Plan typically does not cover hospice care. With Part C, the individuals can switch coverage during the open enrollment period. The only element that is left is to go over Part D. Part D is the drug coverage element. If the individual has Part C, the drug coverage is not needed. But if they have Part A and B, drug coverage could be beneficial or needed depending on the medication cost. When working in the position you have been hired for, you may have patients need clarification on the Part D donut hole. The donut hole is where the patient has hit the initial coverage gap and will have to pay 25% out of pocket for all prescription drugs until they have met the coverage limit. The donut hole can be often a difficult position financially for the patients. It is critical that the patients can have an understanding, and you may have to help with educating. Now that we have gone over all parts of Medicare, we will begin to go over the different claim forms used for reimbursement. The position you have been hired for, will require you to fill out claim forms. It is critical that you know what forms need to be filled out for what services and what locations. If the information is not filled out correctly, the claim can be rejected or denied. You are responsible for all information entered on the claim forms. Accuracy and efficiency is a must with billing. There are two different electronic forms, 837I and 837P. The I stands for institutional and the P stands for professional. The two paper forms are CMS 1500 and UB04. Within the next slide, we will go over what forms need to be completed for different locations and services provided. Please make sure you know the importance of the forms and what sections need to be completed for the correct reimbursement. Institutional billing is for the claims provided in the hospital setting, nursing homes, some inpatient and outpatient services, the equipment and supplies, laboratory and radiology services. The billers will only provide billing services, collection. No coding will be performed. The two forms utilized for institutional billing is the electronic version 837I and the paper form UB04. Professional billing is for the work provided by the doctor, suppliers, and other inpatient and outpatient services. Most professional billing is for the services provided in the physician's office. The two forms used for professional billing is the electronic version 837P and paper form CMS 1500. The responsibilities that you will have being a professional biller is billing, coding, and sometimes collections. The last topic I will go over is the EOB, or explanation of benefits. The EOB is a document sent to the patients to explain the charges, payments, and part of what they may owe. It is vital that they understand that it is not a bill. Often we receive calls about the EOBs, and you may have to explain what it is for. The EOB is for their records and can be used for documentation for their out-of-pocket expenses. We must know what the common terms mean that are used on the EOBs, so we can explain the parts of the EOB with confidence.